I'm Rosie Bartel, and I live in the city of Chilton, Wisconsin. Exactly 3 years ago to yesterday, the knee started, and I went in for a routine, what I considered a routine knee replacement. I went in to get the stitches out after 10 days, and right after I got the stitches out, it started having problems. I started having drainage. I called the doctor, and he said, come right in, and I got in there, and he said, I've got a window of 24 hours to clean this out, or we're in real big trouble. So he went in that afternoon and washed it out and put all new plastic in, thinking he got ahead of the game. And basically the next morning I had him and the infectious disease doctor in my room telling me that they're hoping I dodged a big bullet, but this was MRSA and it was pretty extensive already. It had gotten into all of the joints that had been put in, and they were hoping it had not gotten into the bone. They replaced it with the new parts. It never healed. So after about 6 months, they decided to take it out and put plastic in. The temporary joint never healed. They went back and forth back. I had 3 times the regular joint put in, the other one taken out, back and forth. About a year ago, they said to me, we're out of options. We can't do anything. We're going to have to fuse it. So they fused it. By this point, they had taken so much of my bone, my femur and my tibia, that taking out the knee and fusing it caused me a 3-inch loss on this leg. This leg was 3 inches shorter than my left leg. Couldn't bend the knee, and again, nothing healed. I went a whole year from June to June and no healing. And so in June, they basically said to me, there's only one option left, and that's amputation. And the only reason they wanted to amputate was at this point, my bone marrow has taken a real hit. And so basically, if they didn't do something now, I was going to have other major problems. So when he took off the leg, he found that the whole bone was infected, and it would have never healed. And the infection had gone from the top of my leg, right below the hip, almost to the bottom. You hear about people, getting infections in their joints after they have surgeries, but this was my 5th joint replacement. So I wasn't at all concerned. I had a total shoulder, both hips, the other knee 6 weeks before with the same surgeon. So I had no fear. To me, it was routine. I was going to have this done, and 2 weeks later, I was going to be back to work, and I was fine. And, I did not expect this to happen to me. The day that the doctor stood in my room, the infectious disease doctor, and said, you have, probably a 30% chance of surviving, it was very scary. And, you hear the word MRSA, you hear about this infection, but people don't know about it, and people don't know how it changes somebody's life. When you're in a hospital, nurses say, oh, we all probably have it, it just hasn't affected us. And it's probably true, but it's not something people know about, and they don't realize how much it can devastate your life. I cannot walk at this point because I have an amputated leg, and because they had it amputated so short, there's no guarantee I'm going to get a prosthesis. And even at this point, I have to have a vac on this leg because the infection there's still some infection in there, and they're trying to clean that up. So at least 2 months yet before it may even heal well enough to even consider a prosthesis. My surgeon is saying to me, don't count on it. We couldn't stay living in the home we were living in because the doorways weren't wide enough. The rooms weren't big enough to move around in, so we had to move. It affected us financially. It caused us to make decisions in our life that we would have never made at this time in our life. We went from owning a home to renting because we had to look at expenses. People say you're one illness away from bankruptcy. Well, that's pretty true. That's pretty true when you have something devastating happen to you and it lasts for 3 years or more. So basically, I went from being a person who worked 14 hours a day. Now today, I work about 15 hours a week and have a hard time doing that. I traveled among 16 counties and 165 parishes. I taught adults how to teach children, and I loved it. It was my dream job. And I basically oversaw all of the religion education in the schools and the religious ed church programs. About a year ago in June, I retired because I just couldn't anymore. I couldn't, in the end, I wasn't able to drive anymore because of my leg being fused. So my husband was taking me to places. He was literally driving me around so I could go and teach in a wheelchair. I was trying to work the hours, and because of my blood counts being so low, I just couldn't anymore. So I took an early retirement from that job, kept the part-time job I had. People used to joke with me that I would win the lottery and I would still work for another 10 years. I mean, people would laugh that Rosie Bartel could win the lottery and Rosie Bartel would go to work the next day because she loves her job so much. And I dreamt I was going to work till 75, 80. I mean, and I was going to be doing that because that's who I was. I'm a very independent woman. I mean, I wouldn't let other people drive because I was the driver other than when he went along. You know, it was Rosie had her good car and she drove. And I don't like waiting for people. I never liked being on somebody else's time scale. And now I'm completely dependent on him. I mean, basically, I can't get in and out of bed without him. I can't get off and on the toilet without him. I can't do anything. Plus, his life has changed so much. I mean, he's got if he's going to go somewhere, he has to make a plan for me. He went fishing on Saturday, and my granddaughter came and stayed with me just in case I needed to get somewhere. Plus, it's frustrating. I mean, for 3 years, I feel like I'm a burden almost to him, you know, because I know he loves me and I love him, and we've gotten closer through this. But yet, it's really hard to always be the person who needs the help. The surgeon who did my initial surgery did my amputation. I mean, he did everything he could possibly have done. And I mean, he apologized to my children the day he amputated my leg because he felt so bad about, he's never had this happen. This is a real big fluke to him. He's a young doctor, probably in his early 40s, and he just has never, this has been a journey for both of us, and we've been on it together, the two of us. And I respect AMC and Theta Care because they knew that this happened in their facility. They came to me. They asked me to meet with them, on a review that they were doing of their hospital, and then they asked me to talk to their board of directors and things. I felt that they were looking at it, and that's all I wanted. I wanted nobody else to live through what I'm living through. I was very happy to hear that they were putting together a week-long study on improvement. It was improvement of their infections in joint surgeries. I just felt that they were really working hard to make changes and that they needed to hear the story because it wasn't going to happen just them saying they needed these changes. As an educator, I always think that when you can put a face on things, when you can make it real, when you teach, when the story is real, I think you touch people's hearts. If you touch people's hearts, you get to their minds eventually, and they look at what can we do different. I think you have to hear from the patient. A patient's not going to just write you a letter. You have to ask. And if somebody had a good experience, they'll tell you, and if somebody had a bad experience, they'll tell you. But I think it's important for healthcare to do surveys, to talk to patients, to listen. It's not about me. It's not about a certain hospital or anything. It's about helping all people and helping others so that this doesn't happen to other people. We're never going to be perfect. We aim for perfect, but we sure can make it closer to perfect.